trying to add up. I believe this is my 5th time having the honor and the privilege to sit before this group to recognize the excellence of the Community Services Board and the whole mental health support services team. We have several other board members that are with us today. If y'all could take the time and stand up to be recognized.
Stand and let us see you. Give you a chance to get a little break there. Here we go. Good. Thank y'all. Thank you for your service.
Absolutely. And I would also like to take this opportunity to express, on behalf of all of us, our sincere appreciation to all of you for the continued support, both in administrative support, financial support, but the culture of the county, I think, extends well into this department in their strive for excellence. And year after year after year, we're truly blessed that the quality of appointees that the Board of Supervisors makes to the Community Services Board allows us to do a lot of the things that we're able to do. I'm going to keep my other comments relatively brief and turn this over to Kelly, who will give us the meat and potatoes of the presentation today. But I was trying to think about what I could say that would encapsulate kind of my thoughts and beliefs of our fellow board members and, quite frankly, the whole staff that comprises the department. And I'm going to thank Kelly because, unbeknownst to her, I'm going to use an email that she sent out. And it has to do with the department recently going through, last week in fact, the CARF accreditation process. And for anybody that's listening and maybe is unaware, CARF accreditation is a recognition from the Commission on Accreditation of Rehabilitative Facilities that a health or human services organizations meet certain standard. CARF is a private nonprofit organization that was formed in 1966. Specifically, CARF accreditation demonstrates that the organization is committed to quality, transparency, and the satisfaction of its clients, which are the citizens of Chesterfield County. It also shows that an organization is open to outside scrutiny, transparency of its business processes, and its service delivery model. CARF accreditation is based on a number of standards, including leadership, human resources, health and safety, financial management, accessibility, rights of individuals served, program and service delivery, and performance measurement and management. I bring that to your attention because, as I mentioned, and this came out on Friday of last week, and I'm simply going to read from this because I think it sums this thing up perfectly for me. This afternoon, and this came from Kelly to the whole staff, this afternoon we completed our 9th CARF accreditation survey. This marks 27 years that this agency has been fully accredited by CARF, and I feel confident, given our exit conference earlier this afternoon, that we will have no problems being fully accredited for the next 3 years and many more to come. The five surveyors from CARF had nothing but glowing remarks about our organization. Over the past 3 days, the 5 surveyors visited all of our programs and services, a random sample of group homes and employment sites, and both day programs. They interviewed consumers, families from every program, and talk to staff throughout the agency and also key stakeholders. There are 2,442 standards by which we were reviewed, and out of the 2,442 standards, we only received 10 recommendations for improvement and 13 areas of consultation, which is considered to be beyond outstanding. Some of the strengths and commendations that were mentioned by the CARF surveyors, our agency is a rare gem in the state among community mental health centers. We are commended on the relationship our Community Services Board has with the Board of Supervisors and County Administration. We are well respected by our stakeholders in the community. Our clients are very satisfied with services and provide numerous examples to the surveyors on how they have improved as a result of the services that they receive. Staff are passionate and committed to improving the lives of our clients. We have an exceptionally caring and committed staff. We have a strong focus on providing trauma-informed care. We are commended for the strong partnership that we have with law enforcement. We have strong interdisciplinary teams of well-rounded, highly competent staff. Staff cite feeling very supported by their supervisors and administration and have the tools needed to do their job and love their colleagues. They provide multiple examples and quotes from families on their success stories, satisfaction with our services. I paint this picture for you. While the CARF surveyors noted this about the exemplary team that makes up mental health support services, I think it's appropriate to remember, as I'm sure you are all aware, that while this was going on over the past 12 months, not only have the routine services that our organization is deemed to provide, have we provided those services in as close to a flawless fashion as we possibly can. But at the same time, we have continued to work through major legislative implementation issues, such as the implementation of the Marcus Alert. The system has transitioned from one electronic health record system to the other, to a brand new system that went live literally while the CARF surveyors were with us. And for those of you that are also aware, at any point in time, and I believe I've tried to count up, the staff and the systems in mental health support services are continually being audited by federal, state, other stakeholders, and I believe there's 9 per year, so it's one audit after the other. So while all of these things are going on, the staff's doing a tremendous job. So I will wrap my comments up with that and turn it over to Kelly.
We ought to stop right there and just say, thank you before you even start for that exemplary report on what you've gone through for the last year. I think that should be noted because I'm about to say and have said you've done a tremendous job, outstanding job. And I heard the word excellence, and we appreciate that so very much. So I just wanted to stop right here and just say we applaud you. Thank you. Ms. Free.
Thanks so much, Gib. Mr. Chairman, members of the board, Dr. Casey, it's a privilege for me to be here this afternoon to continue on and talk a little bit about what we've accomplished over the last year. We have all of the senior team, well, those that could be here today, so I would like to ask them to stand as well to be recognized.
Please stand, team. Thank you.
It is true. All the things I'm going to talk about, all of the things that we've accomplished, all of the standards that are being met are met because of the team that we have here and all of the staff that are working really diligently every day to ensure that we're providing the best services that we can. So as I start, obviously our mission is to promote wellness and recovery for those with mental health, substance use, and developmental disabilities. Looking at who we served in fiscal year '24, we served over 7,300 residents here in the county, which is an increase over fiscal year '23. We have continued to see increases in bouncing back since the pandemic. We also continue to see a large increase in our infant program, and that's something we're really trying to watch to see what's going on there. But last year we served 1,552 children, which was an increase of over about 127 children from the previous year. And the previous year was our largest increase. We saw a 22% increase in the number of children served. So our infant program is now third in the state in the numbers that are being served, and we're actually third by one child. So may as well say we're second in the state there. We have a strong reach throughout the community. Our prevention services serves, last year served about an additional 8,700 individuals. That didn't count the over 1 million reach we had through Facebook, social media posts, because they post something each and every day on Facebook. And also in addition, they did merchant education by providing 171 visits to tobacco retailers and 104 gambling retailers. And in addition, we had outreach in the community of distributing over 5,000 prescription drug disposal pouches and 201 locking devices for medications and guns, all, again, distributed through our prevention program. And as Gib mentioned, we're very pleased over our recent accreditation survey visit. Looking at our revenue, we are, our budget for FY25 is approximately $59 million. The majority of that, of the revenue is Medicaid, Medicare, and with insurances, Medicaid, Medicare, and insurance at $28.3 million, followed by the county's contribution of $16.3 million, and then state and federal funds at $9.9 million. Of the expenditures, our highest expenditures are for those with intellectual and developmental disabilities, followed by mental health services, and then lastly, substance use disorders. We spend about $5 million or 10% of our budget in administrative support, which is consistent from prior years. And all of our FY25 additional funding requests were covered through outside revenue. There was no cost to the county general fund. Looking at some of our key highlights, as Gib mentioned, the first thing, after planning and developing the system for over a year and a half, we did implement the NetSmarts NX product as our new electronic health record. And this was implemented as of July 1, so we are very green still in these first few months of working out the bugs through the implementation process. But right out of the gate, nothing stopped any services that we were providing as a result of implementing this new system, which is amazing. The new product will provide us much needed enhancements such as built-in telehealth, a client portal, lab interface, user-friendly client statements, which have been a rub for a long time with our citizens, and we have very robust key performance dashboards. I do want to congratulate, again, all of the staff and the implementation team, which was guided by Tim Adams, who could not be here today, and Danielle Sayer, both our assistant directors, but at the same time, I have to thank all of our leaders here because they were key in developing this throughout our whole agency. A couple of additional key highlights. We received 2 NACO awards this year, one specific to our department, which was Mental Health is Ageless. Older adults had the highest rates of suicide in the United States and Virginia in 2022. Based on this data, our Chesterfield Mental Health Support Services staff and the Chesterfield Suicide Awareness and Prevention Coalition decided to focus on suicide in older adults for the September 23 campaign last year. And so, you know, as they were trying to promote, depression and suicide are not a standard part of aging. It is important to be aware of signs of mental health concerns and connect to help when needed. The campaign promoted that being involved in meaningful, recreational, creative, and social activities contributes to positive mental health. And you're not alone if you're struggling with your mental health. Reach out for help, and resources are available. So this campaign included videos, presentations to older adults, and professional groups that serve older adults, mailings to primary care physicians, print material distributed, and also radio ads. The second NACO award, that was a human services initiative, but there were a lot of specific things that we did within our department, which is around secondary traumatic stress. As we know, this refers to the experience of people, generally professionals, who are exposed to others' traumatic stories as part of their work. As a result of this exposure, these professionals can develop their own traumatic symptoms and reactions. And so through this partnership with the University of Kentucky, we were able to capitalize and develop a lot of initiatives throughout all of our departments. You'll see the sliming poster up there, which was developed. And what sliming is when you tell someone about a traumatizing event, but provide so much detail that you traumatize the person that you're actually telling. And so a no sliming zone doesn't mean we shouldn't share with others, but it means we should be mindful of the details that we're providing and the words we use. And so this was just one of the many strategies that we learned and implemented within our department and educated our staff on to reduce the impacts of secondary traumatic stress. And we also earned a VACO award on the secondary traumatic stress, which will be awarded tonight. I want to talk a little about peer services. I do not think that I have presented on peer services before, but certified peer recovery specialists are key positions that are now embedded throughout the county. We have them currently in our department. We have them with the mobile integrated healthcare team through fire and EMS. We have them in the treatment courts and the police and sheriff's departments. A peer recovery specialist is a trained professional who has a personal experience with mental illness, addiction, co-occurring conditions, and recovery. They use their own experiences to support others who are going through similar challenges, and they're very powerful in working with individuals struggling with these challenges. They are certified. There's specific requirements. They have to have at least 1 year of recovery from a mental health or substance use challenge, or at least 1 year as a family member supporting a loved one. They have to accumulate over 500 hours of experience providing peer support services. They have to complete 72 hours of a training through the Department of Behavioral Health and Developmental Services. They have to be registered with the Virginia Board of Counseling, and they have to pass a peer recovery specialist examination. So these are trained peer recovery specialists. We currently have 11 peer positions hired in our department, mostly in our clinical programs, and we recently hired a lead peer to help unify the workforce and extend the peer provider voice into new areas across the county. This is the biggest thing we hear, is that keep adding those peer providers because they truly are making a difference. Problem gambling. This is a new thing that, not a new thing, but area of focus that we are particularly paying attention to as legislation may or may not continue to change. Legislative changes over the past year, though, have included legalization of sports betting and casinos in Virginia and have greatly increased access to gambling as well as decreased the perception of harm. Problem gambling is defined as the urge to gamble despite harmful negative consequences or a desire to stop. Problem gambling is highly associated with substance use and mental health concerns, including suicide. Youth gambling is associated with greater likelihood of problem gambling, as well as educational, mental health, and substance use concerns. Chesterfield's Mental Health Prevention Services Program works to increase awareness of risks associated with youth gambling, signs of problem gambling across age groups, tips to gamble safer, and awareness of resources related to problem gambling through professional and parent education, radio and TV ads, information disseminated at community events and county locations, as well as social media. That's just an example of a program that was developed in coordination with the county schools' FACE Offices Coffee and Conversation series. And so this program that they developed together with the prevention team is presented now as a model for use by other CSBs across the state. Moving on to our housing partnerships that you have very much supported. Housing has been a key part of our service delivery system for many years. We started with our group homes for those with intellectual developmental disabilities back in the, late 70s, early 80s, which led to our partnership with Chesterfield Alternatives Incorporated. Through the years, studies have shown that individual apartment settings are more appropriate for individuals with mental health and substance use challenges than traditional group home settings that are more appropriate for those with developmental disabilities. So we have been working for some time moving in that direction to see how we can provide affordable housing for the mental health population. We are so appreciative of the county's support and working alongside us to develop partnerships with the various developers to enable us to find suitable housing for the population. This past May, Better Housing Coalition held their topping off ceremony for Horner Run, which will provide 8 units for the CSB clients when they open in January of 2025. We also are partnering with Woda Properties for 3 additional units at Lambert's Landing, which are due to become available this fall as well. Both of these opportunities are for individuals who do not meet the criteria for permanent supportive housing, which is the 3rd level of housing that we provide. Therefore, because they don't meet that level of housing, they do not have any other funding stream to help support their housing needs. And that's the reason why affordable housing is so critical for this population. So again, we can't tell you how much we appreciate the partnerships in this area. As I just mentioned, this 3rd level is permanent supportive housing that we are able to provide to a finite number of individuals with serious mental health challenges who are at risk for homelessness. In FY23, the Department of Behavioral Health and Developmental Services provided funding and slots to enable us to support 30 individuals in obtaining stable housing. And it's not just the housing, it's any needed wraparound services and supports to assist them with not only obtaining their housing, but sustaining their housing placements as well. The first year, we worked diligently to find housing placements for individuals as well as staffing the program, and were successful in placing all 30 individuals into housing. This past year, we were able to really see the outcomes, and as you see above, 30 individuals were placed. There were 0 evictions or involuntary discharges. Some of the more key outcomes is that 75% exited homelessness through this program. And another huge one is 89% now have a primary care physician. That is a real challenge for those with serious mental illnesses, is they don't have access oftentimes to primary care. They have a lot of comorbid conditions. And so this is really positive that not only do they have the stable housing, but they're getting those needed wraparound services and the medical care that's needed. They're also gaining employment with supports, and they're remaining stable following hospitalizations. Everything is not perfect. We had a few arrests, but again, that's what staff are for, to work with individuals, help them through these challenging situations when they may have a setback, and then get them back on the right path. Due to our continued success, the Department of Behavioral Health and Developmental Services provided us additional funding this year to be able to expand to 15 more slots. And so on your evening agenda tonight, there is an agenda item for us to be able to add 4 additional staff, staging it in based on when we are able to fill the 15 slots to continue to support the program. The agenda item does not have funding written in the agenda item because they have made that part of our base budget that you included, or that was included when you approved our performance contract last month. Just want to tell a success story about how powerful this program is. This is one of our permanent supportive housing clients who has experienced dramatic recovery since she was originally housed. When she was admitted to the program, she had been homeless and unsheltered for 2.5 years, with the exception of 2 psychiatric hospitalizations lasting 5 days each, and 3 months in jail for assault and battery while in the midst of a manic episode with psychosis. Staff placed her in the in-town suites in Chester during her housing search, from which she was banned after telling another person staying there that she was going to kill his mother because he didn't have a cigarette for her. She was also hospitalized during that time period, and staff went to clean out her hotel room only to find a cat and a betta fish living there with her, both of which staff were able to save and return to her at a later time. Since being housed, she has been completely stable and thriving. She has dealt with all of her criminal charges, has begun receiving benefits, received her driver's license, or, well, she got it reinstated. She hasn't had anything resembling a crisis and asks for help when she needs it. Recently, she was treated very poorly by a maintenance worker who had to come to her home to deal with a maintenance issue. And she was able to manage this without being reactive and without otherwise melting down or going into a crisis. Staff have done really good work and have built a strong therapeutic alliance with her, and we are certain that this has been key to how far she has come. At the same time, having a safe place to live and to express herself has played a huge role as well, at least as significant as staff's wraparound services. According to the program supervisor, Adam Seehaver, housing is medicine, and he believes in it so much he said he might get that tattooed on himself.
That's just wonderful. I just
Yeah.
want to say thank you.
Definitely a success story there. September is Recovery Month. We have a lot of celebrations in September. So September is Recovery Month, so we always like to discuss the substance use trends that we are seeing. In 2023, 86 people lost their lives in Chesterfield from a drug poisoning event, which represents a small increase from 2022. Opioid-related deaths accounted for 87.2% of the total overdose deaths in the county. In the first quarter of 2024, now all of our data is always delayed. It comes from the medical examiner's office, and so we are always delayed in receiving that. But just in the first quarter of 2024, 15 residents died of a drug poisoning. The drug supply continues to pose a challenge due to the contamination with other substances. So for example, we're really seeing powder cocaine contaminated with fentanyl, fentanyl contaminated with xylazine. Those are the two that we're really seeing lately. This inconsistent and contaminated drug supply directly impacts fatality rates. We know that 3 of those deaths that occurred at the start of the year were a cause of xylazine as a contributing factor. And it is most often cut into fentanyl and is not sold separately. So I'll tell you a little bit more about the impacts of xylazine. The impacts of xylazine are deep sedation, which puts people at risk of blood clots and pressure wounds from not moving, also put them at risk of being victimized and increased risks of overdose because Narcan does not work on xylazine. Xylazine is not approved for human consumption. Actually, it's only used in veterinary medicine. And when they attempted trials previously, they shut them down because the subjects reacted very poorly. Low blood pressure, slow breathing, slow heart rate. It is also known for causing wounds on the body, and these wounds often grow very quickly. It is difficult to test. You know, we provide urine strips to folks to test some of their drug supply. It's very difficult to test in urine and illicit substances because the testing strips can have false positives when cocaine is present. We have limited data from the medical examiner as they struggle to get their process for xylazine testing post-mortem up and running, but we should start seeing more accurate data in FY25. We continue to grow our outreach and harm reduction services to meet community needs in collaboration with many other county departments. Training and distribution efforts occur not only in our department, but also in the libraries, community corrections, fire and EMS, the Department of Social Services, and the jail. And through these efforts, now I'm switching, this is just substance use in general. Through these efforts, 3,299 boxes of Narcan were distributed in FY24. And we do feel like this is contributing to reducing overdoses. In addition to increase harm reduction efforts and to address the signs of xylazine, we're always having to come up with new and different things to help our residents. Our department purchased wound care supplies, hygiene supplies, and general first aid supplies, and assembled 95 wound care kits and 120 hygiene kits that are available for CSB clients or community residents and are handed out during routine community outreach when our staff are in the community educating and providing other resources to residents. As an additional educational effort on substance use, Lauren Lysted, our substance use response supervisor, trained all Chesterfield PE teachers about substance use trends and risk protective factors during a professional development day prior to the school's opening this year. The efforts mentioned are specific to Chesterfield, but Chesterfield is also part of the Opioid Settlement Grant Awards to increase outreach efforts across our region, and Lauren is playing a key role in assisting other localities in developing similar outreach programs, modeling after what we have developed here in Chesterfield. As I previously mentioned, September is Recovery Month, and there will be a regional recovery event on September the 30th, next Monday, at the Henrico Sports Center. And so this event is occurring. It's open to the general public. It's opened. It'll be available from 1:30 to 4:30 in the afternoon. There'll be several speakers. There'll be 48 vendors there, all representing recovery-type services to provide educational information to anyone who's able to attend. Continuing on the recovery theme, Chesterfield Recovery Academy completed the second year of our second school year last year. 38 students were served over the course of the year. This, as we know, is a regional school, and so of the 38 students, 10 were from outside of Chesterfield, representing Henrico, Richmond, New Kent, Hanover, and Petersburg. We continue to see good outcomes. We had 10 students who graduated from high school, and the rest completed their grade level. 15 students gained employment over the school year. We provided over 200 clinical recovery groups and over 1,500 individual clinical sessions. And over the last school year, the students achieved together, all of the students, 79 months of sobriety. At the start of this school year, 12 students are enrolled. You know, we always lose some, and then we gain a whole lot more after the school starts once additional students are assessed. But we started the school year in August with 12 students, 5 of those being from those same other localities. So enrollment, you know, we know will likely increase. In addition to Recovery Month, September is Suicide Awareness Month, and so staff have been busy participating in community events throughout the month. This slide contains the total number of county-wide suicide-related police calls, and then a breakdown of attempted versus completed suicides. The orange bar represents the percentage of the total calls that involve juveniles. Because the number of juveniles tends to be very small, we do it in percentages, not to, for confidentiality reasons. As I mentioned previously, we did receive the NACO award. Older adults did have the highest rates of suicide in the state, as we said, and actually in the nation. And so that's why the other initiatives have taken place. But we're not ignoring in any way, shape, or form the juveniles who we are seeing attempting and unfortunately having a few completed suicides. So we have been partnering with the schools on a number of initiatives and strategies to increase mental health awareness and resources available, including highlighting the 988 awareness campaign, and I'll talk a little bit in a minute about 988. But just to expand a little bit more about what we're doing in the schools, our prevention teams have been in the schools for years, and they are, very active in all of the different grade levels. They provide classroom lessons starting in elementary school, so it's really geared toward the age of the student. In elementary school, it might be about bullying, it might be Too Good for Violence, All Stars. Those are some of the classes they do there. Once you get to middle school and high school, you're starting to get into anger management, substance use classes, understanding mental health, and of course the signs of suicide classes that are provided to 7th and 10th graders. And as you can see, over 223 classes of signs of suicide were presented to the students last year by our staff. In addition to whole classroom lessons, there's also small group classes because there are times when there's a segment of children that might need more specific attention. And so there's groups that are held on friendship, grief, changing families. A lot of families are dealing with divorce. Stress and anxiety is a big one. A lot of children, because of the test anxiety and the stress of the SOLs, have some challenges. In middle and high school, again, anxiety, divorce, separation, empowerment, grief and loss, healthy relationships, anger management, social skills. A lot of these are the types of group classes that are being provided to students outside of their daily instruction. There's adult classes, understanding your young children. They don't come with instructions. That's one of the classes. Talking about parenting when you have teenagers. And then, of course, mental health first aid for youth and adults are provided throughout the year. There's one-on-one parent consultations that are provided if needed. There's also, and those can be on effective discipline, setting limits, building communication. We have a lot of parents that will come to our department just for one-off sessions, more if needed, just for some of these things that they're seeing with their children. There's also training that we do with the school personnel around communication with teens, stress management for teachers and school personnel, issues surrounding substance use, trauma stewardship, enhancing your wellness as professionals, just a lot of things. So it's from students to teachers that we are there to assist them. And then, of course, there were a lot of strategies targeted to youth and families around the 988 education, incorporating messaging into the signs of suicide lessons for the students, delivering presentations to additional grades about 988, including information in all the school counseling offices, sending information home with parents, social media messaging that we have been doing. They're looking, or they explored putting the 988 on the back of student ID cards, as well as putting them on their Chromebooks. So lots of work is continuing to take place because there has been and is continuing the national campaign on getting the word out on 988. So again, tons of stuff working with youth. And then, of course, I don't want to forget our Healthy Families program. They're working with children from birth, or actually before. They work with young parents as before children are born, all the way up to age 5 to really help at-risk families ensure that they are very ready by the time their children approach going to kindergarten. So just giving them that additional boost that's different than the Head Start program that also provides similar services. And then the last program that we'll talk about, as you know, is the strong partnership that we have with police on 988 and implementing the Marcus Alert protocols that went into effect last July. I will have to say that I hear a lot about our other colleagues in the state, and we are really put up there through the Department of Criminal Justice Services, as well as DBHDS, on the program that we have here in Chesterfield. And I believe is the foundation that was set years ago with the police. We've been doing CIT now since 2015, I believe, or it might be 2012, but I think it's 2015. It's just a strong foundation that all of this new program was built upon. And they know it in the state because if the mental health department and the police department are not completely aligned in this initiative, it's going to make it challenging. And so we have had nothing but a success story so far. 988, as you see the outcomes, 988 calls that were answered last year, 2,796. I will say the first 2 months of FY, I get our years when it's budget season, start getting them all mixed up. I think we're in FY25 now. Just in 2 months, we're almost at half of that number that 988 has answered. They were answering 100 to 200 calls a month during the beginning of the rollout, and now, and this is for Chesterfield. And we receive each month's data about 10 days after the close of the month. And for July and August, they were answering 600 calls on behalf of Chesterfield in both months. So that is alarming. We're looking into it. But again, they are handling those calls because, as you can see, the 911 to 988 transfers, that's where our 911 dispatchers get a call, and they can tell that it's a call that really can be transferred to 988 because it's considered what we call a level 1 call or level 2. They're very small because when people call 911, they're typically looking for a police response. And if they ask for a police response, police cannot transfer them to 988. They are going to respond. So the numbers are much lower, and they're lower across the region. They do not just automatically transfer calls to 988. On the other side of things, you can see how many calls could 988 handle, or did they need to involve 911? And there were 27 out of the 2,796. So a lot of calls can be handled. It's a very good program. But then look at the next one. The next one is co-response calls. That is our mental health staff going out with police in Chesterfield to handle calls. And so right now we have 2 co-response teams. There's been conversations immediately that police and our staff feel like they could add a 3rd one right away and possibly a 4th one. So we're we're looking at resources and trying to determine, looking at our data, the days of the week, when the most calls come in, and really trying to map out where do we need to add these additional teams. But the biggest success story here is of the 449, 254, close to 60%, were able to avoid hospitalization by being served with a lower level of care. And so that was the goal, and it certainly it is working. What's even better outcomes is of all of those calls, the 449, only 16, which is 0.04%, resulted in arrest. Again, we're trying to avoid placing folks with behavioral health crises in jail. So only 16 led to arrest, and 37 were juveniles. So in the last quarter, police started tracking how many patrol hours are saved by the co-response teams addressing those behavioral health crises. 259 hours were saved during April through June, but that's the brand new statistic, and now we're tracking it starting this first quarter. So that's information I'll be able to present to you at a later time. So in closing, we have to thank the many partners. These are the symbols, but we can't do it without strong partnerships with the folks that we have here, the Kiwanis, REACH, Mobile Crisis, Chesterfield Health District. I mean, we have just so many. There's so many more than are on the sheet here. But again, we can't accomplish what we do without our partners. So just want to thank them personally. Again, thank the team. thank the the CSB board members and the board members here. That is one thing that was highlighted in our CARF accreditation, was that they could see the strong partnership that our board has with the Board of Supervisors and the strong support that we have through county administration, and they don't see that either across the nation. So they were very impressed by that, and so I thank you for that.
Thank you so much. Any comments, supervisors? Comments, questions? If not, okay. Yes, please, Ms. Snyder.
Kelly, I noticed that Robin's Hope was up there on there, and I know that they recently lost some of their state funding. Is there?
They did. And we have already reached out to them. I did hear, she did reach back out to me the other day, and they're not going to need to close immediately as of Monday. That's what they were fearing they were going to have to do. They definitely are going to have to scale back a little bit, but we're going to kind of rally around them, see how we can work with them. And I think they said, they're okay till maybe January. But yeah, they have been a tremendous partner with
I know
us.
they're right down the road from my house, and they
Yeah.
do a great job
They
in
do.
the community. So, thank you.
All right, thank you. Yes, Dr. Miller?
Not necessarily questions, but just comments. Just for the community, I mean, they're kind of picking up on what Mr. Carroll is saying as a mental health professional, how difficult it is to get CARF accreditation. It is an enormous amount of work. And to show year after year consistently how successful we are to be receiving the CARF accreditation, which is the gold standard, is a lot to be proud of. And just watching it through the years is so much to be proud of. Connected with that, I want to make just an observation, I think, for the community also with regard to secondary trauma. The folks who show up as a mental health professional, I also have this affliction, which is having an overactive empathy gland. Which means that we so much identify with and want to help those that we work with. And so what our staff does every day in mental health does affect folks because of how much we care. Especially being on staff at mental health. So I just want to kind of speak to that and how important that program is, that we're taking care of ourselves, taking care of our staff. It's one of those things where it kind of sneaks up on you. You don't realize. I'm a long distance runner. Someone got hurt in front of me, hit by a car. And I went into a depression afterward. And I'm supposed to have a PhD in this stuff. And what ultimately happened was it was called to my attention that in a way I had gone through it too. And so it's one of those things where how important it is to have that supports that are there. The other thing I wanted to talk about was just another comment is that how challenging addiction is. Especially given the fact that in many ways the state sanctions addiction, which makes it that much more difficult. What I mean by that is that you can go out and legally buy alcohol, and how because of that, and now how so often our emergency workers, sometimes very much supported, well, go home and have a drink. And before you know it, you're not working with the kind of feelings that you should be working with, and you mask them. Or if it's tobacco, or now it's gambling, it just continues to it just continues to confound us, and we have to continue working with it. I'm just so grateful for what you all do. And that's not even taking into account the area that I worked in, which was intellectual disabilities, and how important those group homes are, how important those staff supports are, those staff that work with them every day, everyone that works with those folks every day. I mean, I'm talking about worth their weight in gold to be able to work with that population, which takes an enormous amount of patience. And for you, Kelly, for your staff, your leadership, so incredibly grateful for what you all do every day. We are lucky in the fact that Chesterfield Community Services Board, Chesterfield Mental Health, you all support Chesterfield. Not all Community Services Board only support one county.
Right.
And so you're able to wrap our hearts around Chesterfield County and support us all. So thank you.
Thank you.
Excellent. Well said. All right, I just want to thank you for an outstanding job. You've continued to do excellent and very well. We applaud you and a recognition mentioned by Mr. Sloan as well. And I applaud all the members of the CSB here. Thank you for all you do. As a team, you make us proud. You make us a model for the state and the nation for that matter. So again, thank you for an outstanding job. And one last thing, if there's anything we can do, please feel free to let us know. Don't leave without sharing what we can do to assist you to further achieve your goals of excellence. Thank you again for being here today.